Why do we need nutritional psychiatry or nutrition and lifestyle for mental health? हाय, मैं डॉक्टर आरती हूँ। मैं एक इंटीग्रेटिव साइकियाट्रिस्ट हूँ और इस वीडियो में आई एम गोइंग टू डिस्कस न्यूट्रिशन और लाइफस्टाइल अप्रोच मेंटल हेल्थ के लिए क्यों चाहिए. So in this video, I am going to share 3 reasons why do we need nutrition and lifestyle approach for mental health or nutritional psychiatry approach for mental health. Reason 1, inflammation and immune system issue. Mental health issues, they are directly related with inflammation in the body and immune system dysfunction. 2, nutritional deficiencies and mental health. There is a connection. 3, microbiome and mental health. जो healthy और unhealthy bacteria का balance है, means microbiome, इसका connection directly हमारी mental health से है. So I'm going to discuss all these 3 reasons in this video. So first we are going to discuss about inflammation in mental health disorder and how this microbiota that I've discussed right now, balance between your healthy and unhealthy microbiome. Is it the missing link? Now, the latest research, it tells us that inflammation is important in the pathophysiology of mental health disorders. And there is a growing evidence that there is gut-brain axis, which is responsible for mental health issues also. So, in this article, we are going to discuss how this inflammation is the cause of mental health issues and microbiota is responsible for this. So there is evidence that connects mental health disorder connection to the immune system dysfunction, and there is a connection of your microbiome to inflammation and mental health issues. So there is very much important thing discussed here. 3 factors that affects our immune system or the inflammation. 1, signals driven by this microorganism. We all have some healthy bacteria and unhealthy bacteria in our gut, and they are giving some signals. 2, hyperpermeable gut means our gut lining gets leaky. When there is inflammation here, gut lining becomes leaky. And dysbiosis means gut infections. What they create is pro-inflammatory stage, means inflammation here. Leaky gut, inflammation here, and that is directly related with brain inflammation. 3rd, inflammation during prenatal period, like people who develop schizophrenia in later life. So there are certain prenatal issues like obstetric complications and maternal, some exposure to infection or stressful situations like loss of partner or war or obstetric complications or starvation. So the concern is this inflammation is directly related with mental health issues. Now, when we are going for treatment only with the medication approach or the counselings, are we able to reduce inflammation? That's a question. Do we need nutrition and lifestyle to manage this inflammation? And now, how many of you want to use nutrition and lifestyle for this approach? So let's go for therapeutic applications for mental health disorders, probiotic studies. There are various probiotic studies that tells us we can reduce inflammation with this approach. Anti-inflammatory drugs or dietary modifications as add-on therapy on mental health disorders. So definitely, inflammation is one of the cause, and to reduce inflammation, we need nutrition and lifestyle or nutritional psychiatry approach to reduce inflammation. So this is one. Two, let's talk about obesity, inflammation, and depression in adolescence. There is a paper which is telling us there is a bidirectional relationship that has been proposed between depression, obesity, and in adolescence. Now, let's talk about conclusions. Adolescents with depression had increased levels of inflammatory factors. Now, this treatment of adolescent depression should include a focus on managing body composition and reducing chronic inflammation to potentially improve treatment outcomes. Means we need to work on obesity as well as we need to work on depression at the same time. So the first factor which I've discussed is inflammation. Second, microbiota that I have discussed, that gut microbiome or your total microbiome is related with inflammation. Now, coming next to this, nutritional deficiencies, the impact of nutrients on mental health issues and well-being insights from the literature. Now, good nutritional status is required for optimal health, interestingly for mental health also. So let's go to the conclusions directly. Mental health is an integral and essential component of human health. An unhealthy lifestyle can be associated with poor mental health, and scientific findings encourage the integration of micro and macronutrients in a well-balanced and varied diet. So let me go to this diagram, which tells us how these micronutrients are important for mental health. Let's talk about magnesium. This is involved in more than 300 biochemical reactions, and we need it for our cellular energy. Omega-3 and omega-6 balance. Folic acid we need for regulation of neurotransmitter production. Alpha tocopherol for reducing oxidative stress, reducing inflammation, and helps in decreasing anxiety too. So, at last, I want to discuss why nutrition and lifestyle. No doubt, there should be personalized approach for every mental health disorder. There is a personalized approach, but let's talk about only nutrition and lifestyle, because your nutrition and lifestyle, it affects your gut microbiome. And initially what we discussed is this gut microbiome, your balance between healthy microbiome and unhealthy microbiome, it is related with inflammation. So now I would like to ask one question from all of you. How many of you want to use this tool, nutrition and lifestyle, for mental health too?